Hi there. I'd like to speak with you about breast augmentation or chest feminization. This is an important component of gender affirmation surgery for many women, not everyone, but for a good number of patients, for resolution of their gender dysphoria. So I wanted to chat with you about what to expect and how to prepare before the operation, what to expect at the consultation and with the interactions with my office, what to expect intraoperatively, and then the post-operative recovery, both the immediate and then the long-term post-operative recovery up until about a year, until you're fully healed. So it's very important to just be as well-informed as you can be as you move forward with breast augmentation. So breast augmentation, is an operation that I think a lot of individuals are probably familiar with, right? It's something that is done by most plastic surgeons and cosmetic surgeons, but I think it's important to understand some of the finer nuances that are involved in working with transgender, transfeminine, and non-binary individuals who do want chest feminization, and I'll talk about that. So in terms of working with my office, as we're getting the consultation set up, my office will certainly be reaching out to you, getting appropriate paperwork, getting appropriate insurance information, which is going to be important to ensure that we can get coverage from a financial standpoint if we do plan on working with insurance. And once we have the date for the consultation, it's important to make sure that we also have all of your medical information or your medical intake form submitted to the office for me to review. If you are, from far away, and you can't make it here to San Francisco where my office is, then we can typically have a conversation by phone. For some patients, we may ask you to send in pictures of the chest, which may help guide the discussion, but my office will let you know if that is going to be important. So for the consultation itself, my goal is to ensure your safety. So I will spend time going through your medical history, going through your medical intake form to make sure there's nothing that would put you in any undue harm. I want to make sure that you are optimized medically, psychologically, emotionally, and socially before moving forward. Even though breast augmentation may be perceived as a relatively small operation, it is still a major stress on your body. And you need to have the appropriate time to recover, the appropriate support, and you want to make sure there's nothing in your medical or surgical history that could compromise your results. So I will spend time with you chatting about that. It's rare for me to ever say no to anyone, but what I want you to be is honest with your own history on all levels, because if there are any concerns from a medical standpoint, from a social standpoint, I want you to bring those up to me so that we can address those and make sure that you're as safe as possible. If there are concerns about stable housing, if there are concerns about use of nicotine products, for example, or if there are concerns about any medical issues, we will work with you. We will work with your community, with your doctors, your insurance provider, to make sure that we can move forward and that you're as safe as possible. So during the consultation, once again, from a medical standpoint, I'm going to look at your medical history. Do you have anything that can contribute to poor wound healing, increase your chance for complications? If you have a history of diabetes, for example, that can increase your chance for wound healing issues, infections. So I want to make sure that your diabetes is well controlled. So typically we'll have to check your hemoglobin A1C, which is a marker for your diabetes, and make sure that's in a good range and that your sugars are in a good range. If you have HIV, certainly not a contraindication, but we want to make sure your viral load and your CD4 are okay, CD4 count are okay. I want to make sure that you don't have any medical issues that can affect wound healing, such as rheumatoid arthritis. For example, there are certain types of connective tissue diseases, Ehlers-Danlos, for example, and other types of syndromes that can make you more prone to developing scarring or wound healing problems. I want to make sure that you don't have a history of developing keloids or hypertrophic scars, because if you do, then we want to find ways of minimizing those post-operatively. From a surgical standpoint, have you had prior operations on your chest, any history of cancer, chest cancer, breast cancer, family history of breast cancer? I want to make sure that we've teased that out. Have you had any prior breast augmentation before? Silicone injection in your chest as well. History of infection or trauma to the chest is going to be really important. Any heart disease, Lung disease going to be really important, particularly from a general anesthesia standpoint. I want to look at your medications. There are certainly certain medications that can increase bleeding, such as NSAIDs, including aspirin, Plavix, Coumadin, Motrin, ibuprofen. So if you're using those, typically we want you to stop those before the operation and then keep off of those afterwards. In some cases, we may have to restart those medications again, but we'll take it on a case-by-case basis depending on how you're doing. But once again, we want to make sure that we avoid medications that can lead to bleeding. Then also, we want to hold off on medications that can suppress your immune system. So medications that suppress the immune system also suppress wound healing. So these would be medications such as steroids, corticosteroids, certain types of anti-inflammatory medications that are used in the case of, for example, inflammatory bowel disease, or certain types of arthritises, involve immunosuppressant drugs. So we'll evaluate those and then determine whether or not we can stop those, and we'll work with your doctor to see if that's the case. I'll review your allergies to make sure that there are certain types of medications that we may have to avoid around the time of the operation so that you don't have an adverse reaction. And then we also look at your history of smoking or tobacco products. So I want you to be honest, because if you do use tobacco products, and I do have patients who have a history of using them, it's important to stop them a month before and a month after the operation, because that can contribute to wound healing. So that includes not just cigarettes, but cigars, nicotine patches, nicotine gum is also going to be a consideration as well. Vape pens, which are more and more popular. So those are going to be very important to keep in mind and make sure that you're avoiding. And then in terms of your social support, it's really, really important to have a team of people, if needed, around you to help you. So a significant other, family members, your community, your therapist, other doctors. It is a stressful operation and a stressful time, so it's always good to be in a comfortable environment where you do have that support before moving forward with the operation. Once we have the consultation, then you'll have discussions with the rest of my staff after our own discussion. But during the discussion, at least with me, what I want to find out is what your goals and wishes are. The vast majority of patients want to be proportional. They want to have a chest that looks feminine, that allows them to wear the clothes that they want to wear, that allows them to be passing, that allows them to feel good, and ultimately have resolution of their gender dysphoria. There are some patients who do want to have really large implants and really have a very accentuated chest. There are other patients who want smaller implants where they just want more of the shape, but they don't necessarily want to have anything that's going to be overly, I suppose, ostentatious. But as I said, the vast majority of patients do want to be in a range that's going to be proportional and appropriate for their body. But I'll spend the time to chat with you and understand what your particular goals and wishes are. We'll talk about the different types of implants that are available as well, and the types of incisions that can be used. And there are a whole variety of ways of approaching breast augmentation. In the majority of cases, I do like to use silicone implants. I feel that they're soft. I feel they create the most natural appearance. I like to use smooth, round implants. These are the standard implants which have been around for decades. There are newer models now that do have a lower risk of complications and tend to be a bit more durable. And if I do see you in person, I can show you those implants so you can feel them yourself and assess how natural they do feel. Another type of implant that can be used are textured anatomic implants. I don't use them as much now these days. The advantage, at least the supposed advantage, is that they create a more of a natural appearance because they are narrower at the top of the chest and they create a more wider fullness in the lower part of the chest. So that's one advantage that some patients might find in using the anatomic implants. But because of the textured aspect of the implants, it contributes to a condition referred to as BIA-ALCL, breast implant associated anaplastic large cell lymphoma. The rate of this is anywhere from 1 in 3,000 to 1 in 30,000 currently in the United States. So once again, it's not horrendously common, but once again, because these anatomic textured implants do have the potential for leading to lymphoma, I do have my patients move more towards the round, smooth implants, which I believe, creates a very good cosmetic result and has a lower chance for risks and complications. But once again, that's a discussion that we can have. But once again, the smooth round implants do create a very, very good, very natural look. In terms of where I place the incision, typically you'll place it under the breast in that fold, under the tissue at that junction between the breast and the chest, about 1 inch in size. And I typically like to place the implant under the muscle. So the options are placing the implant on top of the muscle or under the muscle. I like to place it under the muscle because there's more soft tissue to cover it. So you have the skin, underlying fat, breast tissue, and the muscle that covers the implant. For most patients, after being on hormones, even for years, you don't develop a lot of breast tissue. And if you don't have a lot of breast tissue, if you place the implant on top of the muscle, there's not going to be a lot of tissue to cover it, so you can sometimes see the edges of the implant and rippling, and that creates a very unnatural appearance. So by placing it under the muscle, there's more tissue that's covering it, which creates more of a natural appearance, and most patients actually prefer this. So that's typically the approach that I go for. Other incision placements can include putting it in the armpit, putting it around the areola. There is a potential for having a higher chance of infection in those areas, and also a higher chance for having malposition of the implants where they don't look quite as symmetrical. In my hands, I get the most predictable results and the most effective results if I do place them in that fold under your breast. And once that area heals, it does look pretty good. In terms of hormones, it is important for you to be on hormones for at least, I would say, a year before the operation, or at least until you're no longer having any breast pain. Because if you're having breast pain, that's oftentimes an indicator that you're still having breast development. So minimum at least a year to see how much you can maximize breast development. The worst thing to do is to actually have a breast augmentation and then to start hormones, and then your breasts develop in a different area than where those implants were put. So that can create very unnatural results and then require revision later down the line. So once again, you do want to optimize your hormones before moving forward. So once again, after the consultation, you'll have a discussion with our financial counselor who will go into the process of working with insurance, if that's the way that we want to go. We'll typically need to get appropriate documentation from your primary care doctor or endocrinologist, mental health therapist, which is submitted to your insurance company in order to move forward. So basically getting appropriate referrals and appropriate letters of support from your care team, and my staff will let you know what letters we need to do that. We'll need information from your insurance company. My insurance team will typically reach out to your insurance company, sometime, at least 3 months or so before the operation, anywhere between 1 to 3 months before the operation, to get appropriate authorization in order to move forward. And we want to make sure that the process is easy for you, so we'll do whatever legwork we need to, so it won't be a difficult process for you from an insurance standpoint. If there are any issues, we'll certainly reach out to you to let you know what the next steps are. You'll also have follow-up with our scheduler, who'll contact you and set you up with an appropriate date to move forward. And then my nurse will reach out to you before the operation to send you all the preoperative paperwork. If there are labs that are going to be needed, then she'll let you know what needs to be done. For the vast majority of patients, if you're young and healthy, we typically don't need any labs or blood work. But for some patients, if you do have any medical issues or there are any particular concerns, then we'll let you know that we do need to get labs beforehand. But we'll definitely keep you in the loop and give you enough advance warning so that you have the time to do that before the operation. For some patients, if you're not certain in terms of the appearance that you're going for, it might be helpful to look at pictures online. You can submit pictures to me or my office to review, and that'll give me a good idea of what you're looking for. But once again, for many patients, you just want to look natural and proportional. During the consultation, I'll also do measurements of your chest, and then at the preoperative visit, I'll do pictures, which we will use as part of your medical documentation before and after pictures. Once we do have that date of the operation, as I was saying, we'll typically set up that preoperative visit about a week, sometimes 2 weeks before the operation. In some cases, if it's hard for you to get here, that far in advance, we may have the preoperative visit a day or so before the operation. But it's certainly important to see it beforehand. So as I said before, I can do measurements, I can take pictures, I can answer whatever additional questions you may have and go through the process of the operation in detail. We'll provide you the prescriptions, all the appropriate paperwork, and also let you know about places that you can stay here in the San Francisco area. If you do live far away, I do ask that you stay in the Bay Area for about 7 days after the operation, just until your first post-operative visit to make sure that you're doing okay. Certainly throughout this entire process, any questions or concerns, you can always reach out to me, to my office, to my staff, and we're happy to help you in any means. On the day of the operation, you'll show up to the surgical facility or the hospital, usually about an hour or 2 hours before the operation. You'll meet the staff, the nurses, everyone who's taking care of you. You'll see me usually about 30 minutes or so before the operation starts. I'll do my markings on your chest to plan everything out for the breast augmentation or the chest feminization. You'll be brought to the operating room and you'll be asleep. It's under general anesthesia, so you won't remember anything, you won't feel anything. For a breast augmentation with implants, the operation will typically take me about, I would say maybe an hour and a half to 2 hours or so. In many cases, I'll do this in conjunction with other procedures such as a vaginoplasty, which is a good way to go because it minimizes your exposure to general anesthesia. But once again, if we're doing it alone, typically about an hour and a half to 2 hours. So as I said before, the primary way that I do the operation is making an incision in the lower part of the chest, and that fold that goes right under the breast, about an inch in size. I have the appropriately sized implant. I will oftentimes order a range of different implant sizes because there's always going to be some degree of unpredictability in the operating room. And then I'll find the right implant that works, and that's the one that I'll keep in place. I use absorbable stitches, so nothing to take out, and then typically use tape or glue to cover that incision. And then we'll put dressings and then a supportive bra in place. After the operation, you'll go to the recovery room. I do inject a lot of numbing medication throughout the operation so that you'll be comfortable post-operatively. You'll be in the recovery room for an hour, maybe 2 hours until the anesthesia wears off, and then you'll be able to leave. But once again, if you live far away, you do need to stay in the Bay Area for another week or so until your first post-operative visit. We do prescribe anti-nausea medication and then also pain medication, a pretty strong pain medication, which most patients use for a couple days. If you're not having a lot of pain, then typically using Tylenol. In some cases, we do allow you to use ibuprofen, but we'll let you know if that's appropriate, which is good for inflammation and then also for pain. So take it easy, rest, avoid stress for a couple days. Wearing ice or putting ice compresses over the area can be pretty helpful. Maintain your nutrition, avoid constipation, because if you're straining or stressed, that can increase your blood pressure and increase the rates of bleeding. So very, very important to remain comfortable. Having support around you is going to be helpful, but you'll be able to get up and move around. You'll be able to get up and use your hands, so you don't have to be bed rest for the entire time, but definitely avoid any strenuous activity. Typically after a couple of days after the operation, usually about 2 days or so, you'll be able to shower, get the area wet, but you do want to wear that supportive bra for at least a month after the operation. We'll provide you with a supportive bra in most cases. Otherwise, you can use your own sports bra, which you can buy and use that to provide a support. No underwire bra for at least 1 month. When you come at the post-operative visit, usually once again about a week or so, afterwards we'll take a look at the incisions, take a look at your chest, make sure there are no signs of infection or bleeding. And then at that point, if you do live far away, you can go back home, and then we'll maintain follow-up typically by phone or email after that for the subsequent year. If there are any questions once you've left, you can always reach my office and my staff. You can send pictures, you can set up other phone follow-ups, which a lot of patients do want to do to make sure everything is going okay. So we'll always be available. So for the first month, once again, avoid heavy activity, strenuous activity, aerobic activity, weightlifting, and then once you get to a month, you can start to increase your activity gradually. But let pain be your guide. If you're doing anything that hurts, that's uncomfortable, then hold off. You can come back a couple days later, maybe a week later before doing that. As I said before, sports bra or surgical bra for a month, and then underwire bra you can start wearing about a month after the operation. So you can go to a department store such as Nordstrom, Macy's, and then get fitted and then find the appropriate bra that you'll need for your new bust size. In terms of risks of the operation, it's a relatively low-risk operation, but with that being said, every operation, everything that we do in life has a potential for risks. So let's start off with risks that are relatively low. So the risk of implant rupture, probably about 1% or so. If we're using a silicone implant, if it does rupture, you're not going to notice it because it's a thick, cohesive gel. So it's kind of like biting into a gummy bear where it maintains its shape, so nothing is draining out. It's the same thing with the silicone. It's very firm and very thick. So if you do have a rupture, typically you're not going to be able to see that just by exam. But usually this does require follow-up ultrasounds or MRIs. So the FDA and implant companies do recommend getting MRIs or ultrasounds every 3 years of the implants to make sure there's no rupture. If there is detection of a rupture, once again, it's not going to be harmful to your health because silicone does not cause a bad allergic inflammatory reaction. But the company does recommend those implants get taken out and the new ones put in. In many cases, the companies will cover it, and even insurance will cover it because it's medically necessary. So then you can get new implants in that case. But for the vast majority of cases, if your implants are fine, no need to have to replace them. Patients ask me that, so it's not like tires on your car that have to be rotated or changed out every couple of years. If they're working well, no need to have to replace them. There's the risk of getting what's called capsular contracture, where you get hard scar tissue around the implants. This happens in about 3 to 5% of patients. But actually having the implants under the muscle, for whatever reason, decreases the chance of getting capsular contracture. If you do get this hard scar tissue around the implant, it's typically going to be firm, sometimes painful. You can sometimes get this uplifting of the implant, which looks unaesthetic. So the scar tissue and the implants need to be taken out and new implants put in. And typically the insurance company and your insurance provider will even cover that because, once again, it's medically necessary because of the functional deficits that can develop from that. Infection, pretty rare, about 1% or so. This area tends to heal pretty well. You get a dose of antibiotics before the operation. Then we keep a close eye on you. We don't use any drains. No need for drains for breast augmentation. Other concerns are getting malposition, where one implant doesn't necessarily match the other side. So breasts, to keep this in mind, are not twins. They're more like cousins. So I think that's important to understand. So no human being has a chest that's symmetrical where the right side matches the left. So before the operation, I do measurements. I point out any asymmetries that you have. So sometimes one chest is wider than the other, one nipple is lower than the other, one nipple is a little bit farther out than the other, and that's okay. That's how we are as human beings. But sometimes after the operation, you may notice that and not have realized that beforehand. But I'll definitely point those out beforehand. I'll strive for symmetry, but getting 100% symmetry is very difficult. Changes in nipple sensation. So having numbness after the operation can happen, but permanent numbness is rarer than usual. So numbness, particularly in the lower part of the chest and also around the nipple and areola. So you do have to give that time. Typically can take up to a year before all that sensation comes back. So massaging the areas can help resensitize, but oftentimes it's just going to be an issue of time. So scarring as well can occur. So for the first 3 months, probably that's where the scar is going to be the most noticeable. It can be red, it can be thick, it can be raised, and then after about 3 months, it should start to flatten down, and the redness will go away. Sometimes you can get some degree of hyperpigmentation where the scar gets dark, particularly in non-Caucasian individuals, and then that will start to lighten up. But the redness, the firmness, the darkness of that scar typically goes away after about a year, but keep a close eye on it. Avoid direct sun exposure using silicone cream, scar tape, for at least 6 months after the operation is going to be helpful. If you do develop scars, or if you have a history of keloids or hypertrophic scars, then we may use injections of cortisone throughout that area to soften up the scar, which we have to do in some cases and can be pretty effective in keeping it under control. In terms of the post-operative recovery, it does take time. Immediately post-op, the implants are going to look large, really high up on your chest. They're going to look like they're all the way up to your shoulder. So I don't want you to be alarmed by that. That's normal. Over time, they will start to drop. I would say you want to give it 6 months, maybe even a year before they fully drop and settle into place. So you do want to give it time. No need to massage. Just let them do what they're going to do. And it's not surprising, and you shouldn't be surprised if one implant drops a little bit lower than the other initially. So sometimes the right side, particularly if you're right-handed, might drop down lower first, and then the left one will catch up later. So I don't want you to worry about that. Sometimes you might hear a little bit of sloshing because there's underlying fluid around the implant. Your body will reabsorb that over time. So don't be terribly alarmed by that. There can be bruising and swelling, which is going to be entirely normal. But if you have rapid swelling, that's more concerning for bleeding, particularly if it's on one side more than the other. If you have bleeding out of the incision, if your dressings are covered with blood, that's going to be more concern for underlying bleeding or hematoma. Once again, pretty rare, but if that happens, just reach out to us so we can evaluate you and make sure that you're doing okay. What I tell all of my patients, the operation in and of itself is the easy part, right? It's that post-operative recovery that can take a long time. So that's why it's important, as I'm evaluating you and chatting with you, that you're open and honest with me with, once again, any medical issues, any psychological issues, mental, emotional issues are going to be really important. Social issues. I want you to be as honest with me as possible so that we can ensure they have the best outcome possible. And definitely be patient, give it time, and your chest will ultimately get to where it needs to be. But as I said, it can be 6 months to a year. And the chance for needing a revision it's not that high. Most patients are quite happy. I think big concerns that patients have are, having, breasts that are too far apart. So working with trans patients who want a more feminine chest, chest can oftentimes be wider than in cisgender women. So in that case, the implants may be, farther apart. For a majority of women, not so much of an issue. You can actually wear, a push-up bra, which helps with the cleavage. In some patients where it's they're still not happy, and once again, it's pretty rare, we can come back and always do a little bit of fat grafting in the middle part of the chest to smooth it out. But once again, pretty rare. Most women are quite happy. Some women are concerned about having larger areolas to create more femininity. Interestingly, when the implants are put in, it oftentimes stretches out the areolas to make them a bit more feminine. But if you still want larger areolas, then typically doing tattooing actually of the areola can help solve that problem. But that's pretty rare. I found that most patients are quite happy with the breast augmentation, that nothing else needs to be done again in the future. But I think those are kind of the biggest considerations to think about after having breast augmentation. So malposition, symastia, that's where you have the implants connecting. Once again, pretty rare. If that happens, that requires surgical correction, or getting bottoming out, where one implant moves down, is traveling down towards the abdomen. That implant needs to be lifted up and be put back into a better position. Once again, the chance of that happening is pretty low. And having the incisions open up, once again, pretty rare, and that typically happens if patients have wound healing issues. In terms of resizing, some patients do come back and ask for larger implants. Typically doesn't happen, but it does happen on some occasions where patients do want larger implants, particularly if they end up gaining weight, and then the rest of their body takes on a larger frame, so they want to have implants that match their overall body appearance. And then going the other way, where patients want to have smaller implants, this can happen more so if you lose weight. Initially we put in large implants because you're of a larger weight and you end up losing a lot of weight. They can end up looking really large after you've lost that weight, so we may have to downsize them to have smaller implants put in. But once again, not entirely common, but it's always a consideration. So that's why I do think it's important when you do move forward with breast augmentation to be at a stable weight. I think that ideally you don't want your body mass index to be higher than 35, and I'll calculate that. That's basically looking at your height and your weight, because you don't have the best results possible, and it also affects the safety, particularly from an anesthesia standpoint. I will make exceptions. We'll take it on a case-by-case basis, but basically I think it's safer to have your body mass index 35 or below, so you don't want to be obese moving forward. It's important for you to be in a normal range. And I think what's even more important is to make sure that your weight stays stable, because if you either gain or lose a lot of weight, so 20 to 30 pounds after the time of the operation, that can also affect your results and end up needing a revision later down the line. But anyway, that's all of the information that I have on breast augmentation. We'll certainly talk in more detail at the consultation. But as I said, give yourself time for recovery. It does take time, and my office and myself are always available as you move forward in the process. Thank you.